has 1,000,001 programs aimed at improving health, and embedded in that health is improving maternal, newborn and child health. They have several programs: Safe Motherhood, High Impact Rapid Delivery Program, they have Free Maternal Health Initiative, just to mention a few. But when you still look at our statistics across the nation, we still have a long way to go.
By the Honorable Deputy Regional Minister.
Stakeholders.
Ghana Health Service is kind of like the supply side, so they'll provide the health service that you need. CBH is more encouraging the demand side uptake of maternal child health services. So we take the messages to them why you need antenatal care, why you need to go to the health service for delivery, because when you do it at home you can die from bleeding, and the traditional birth attendant, for instance, cannot save you at that point. So when all these messages are said over and over and emphasized, and there's encouragement from the entire community to support it, then we'll get the communities now to uptake the services that Ghana Health Service is providing. So for instance, if a woman is pregnant and needs health care, and she has to sit in the house and wait for her husband to come from the farm in the evening to say, okay, can I or can I not go for to see the doctor because I have this condition? That is what some culture practice has taught her. But if we go with the messaging on CBH and we tell her, look, your health is key, it is important, and then we teach you that there's community support. So if your husband is not at home, but the community emergency transport system, for instance, is in place, and they can help transport you to the clinic in the absence of your husband, then you have the knowledge and you have the community support. So you are empowered, like you have some power to take those health-seeking decisions that will improve the health of pregnant women.
What motivates the entire community to build up that unity and to support pregnant women? And that is what we are looking forward for now. Because the entire community must make it their responsibility to make sure that every woman survives. It shouldn't be, the worry of just an individual or a household, but the entire community.
In addition to the incentive, which is kind of, the kind of a central piece to the overall project, there are lots of other components that we're working with that will help provide information and knowledge and hopefully behavior change that will in turn lead to sustainability of the knowledge and behaviors. So one of the things that we're ideally going to be working with are through using community champions. So this is someone who is an influencer in that community, and also someone who is a positive deviant. So they've been exhibiting positive behavior, and that positive behavior, we're seeing positive outcomes. So for example, in the communities that we work in, one of the women is a key influencer in that community. And so we want to use her as a champion and as a voice to create behavioral change in the lives of the women in that community. And she can do that by telling her own story, by telling her own experience around accessing ANC, around delivering in a facility, around inclusive breastfeeding. So using the women in that community who have done those behaviors and have seen positive change would be really important to how we create sustainability.